All right, so PSSD is post-SSRI sexual dysfunction. So it's kind of a diagnosis of exclusion, but let's start with what is an SSRI. Here's a list of common SSRIs, which are selective serotonin reuptake inhibitors. These work at the level of the brain, usually to treat depression, anxiety, or mood disorders. But here you have an example of the generic and the brand names that are most commonly used here in the US. The most common side effect from SSRIs is usually some sort of sexual dysfunction. It can range from 15% to 80%. So most studies show about 50% of people, most commonly women, because 2 to 1, they're the one prescribed SSRIs. Now getting back to the PSSD part of this question, which is post-SSRI sexual dysfunction. Now this is still being studied, there's not a lot of data on it, but it's basically a diagnosis of exclusion where people who have been on SSRIs for a long time have this prolonged effect of decreased libido or unable to have an orgasm or sensation is decreased, so they don't have any other answer, as in everything else has been ruled out, and this is now the issue. So there have been studies trying to see what can treat this issue, right? So after excluding all other reasons to have some sort of sexual dysfunction, studies have been working on certain medications that can help with it, or certain laser therapies or phototherapies that can be helpful, which seem to be promising, but no, there's not definite answers yet. There's not a definitive treatment yet. Studies still need to be done.